Good morning. For those that I have not had the pleasure of meeting, my name is Maria Cardielos, and I've just recently been appointed as the Executive Director of the IJIS Institute. On behalf of our board, directors, and staff, we welcome you to the 2020 IJIS Institute mid-year briefing. Though we present this event virtually, we have hoped to accomplish many of the same objectives of our past briefings, not the least of which is bringing together public and private sector leaders to collaborate on how best to address existing challenges. Needless to say, in today's climate, we are presented with more than enough challenges to address. In this year's event, we naturally focus on the world around us and how our partners from public safety, from justice, from health domains, and more continue to meet their operational challenges daily in the midst of a worldwide pandemic and police reform climates. Business continuity and success is front and center. Our goal is to better understand how collaboration, to include the IJIS community, could better enable their success. Over the course of 6 webinars, we start to discuss what is a story or the evolution of the pandemic in the following manner. We start with lessons learned, albeit early in the process. We continue with leveraging technology to better support the cause. We present challenges with and availability of financial resources to meet those operational needs. We follow with post-pandemic planning while simultaneously planning for the next phase. And we then seek to understand the changes to our operational cultures in all of our individual agencies. We wrap up the 6 webinars with ensuring that we meet critical data sharing needs for our priority decision-making. Our intention is to share this story of our mutual lives and come to address how we can collectively support the cause. As is fundamental to the mission of IJIS, we then seek to identify next steps to include valuable tools for our partners, to include a roadmap, a playbook, policy guidance, or other tools or assets to aid in the meeting of our collective needs. As many of you know, IJIS convenes advisory committees on multiple disciplines to include law enforcement on the federal and local levels, courts, corrections, technologies, and most recently, one on emergency communications. Though we typically align these meetings to our events, the mid-year briefing will continue next week with independent committee meetings and then a joint session to be held Thursday, August 13th. During the sessions, the conversations will continue on how best to support the mission constituency and their needs in these trying times. We encourage your participation in this session, and we ask that you go to our website for more information. For just a brief moment, let me touch on a bit of housekeeping. In this virtual delivery, though the audience will be muted, we encourage participation with questions or comments via the chat function to the right of your screens. We've also allotted some time at the end of each panel to respond to those questions. Finally, without further delay, let me introduce the first panel entitled Combating the COVID-19 Pandemic, Lessons Learned from the Field. Steve Ambrosini, Program Director and former Executive Director of the IJIS Institute, will moderate this great collection of thought leaders. They include Colonel Patrick Callahan of the New Jersey State Police, Dr. Bill Hazel, former Virginia Secretary of Health and Human Services and current Senior Advisor for Innovation and Community Engagement at GMU, and Dave Mulholland, Administrator of the Arlington County Emergency Communications Center. Our goal today, presented as informally as possible, is to share their experiences, their individual or collective responses to same, and what differentiators might exist with their agencies or state approaches that constitute lessons learned for the audience. From our many meetings with our panelists, there will be many more lessons learned than we have time to share today. We thank you for joining us. For those who plan to be with us through the webinar series, we will chat with you later. Steve, I hand it over to you.
Thank you, Maria. Good morning to everybody, all of you from around the country. Thank you for joining us today. We have a panel that I think is going to be a very interesting and unique panel because you're going to hear about an intersection of law enforcement, health, and emergency services in today's panel. As Maria stated, this is part of a series of the coping with the COVID pandemic today and tomorrow. And again, on behalf of IJIS, our panelists, and myself, thank you for choosing this panel. So a little bit about the panel, just before we get started, and kind of give you a little bit of context. In this intersection of law enforcement, public health, and emergency services, we're going to be talking about maintaining civil order in a time of really things, as we know, have gotten out of control in a lot of places, and in some places they've been going very well. So we're going to be talking about what some of the areas of focus, priority, and how some of those who are doing well are dealing with that. We're also going to talk on the health side about trying to catch up with an unknown and rapidly spreading killer, talking about the challenges of coming up with treatment, immunization, and really at the center of all this that we're all experiencing is the ability to communicate public health advisories and public health standards. And then continuing to adjust our response models in the emergency services world to continuously maintain the ability to respond to continuing calls for help. We do those through the 911 systems because people are still having heart attacks, people are still involved in auto accidents, and there's got to be somebody at the end of that phone line when they call, and there's got to be responders who can get to them. And then through all of this, continuing to assure that we learn from our experiences and insights as gained from the lessons learned over the last several months now that we've been going through this. On the leadership side, what we really want to focus on is recognizing the first priority, which is keeping our citizens and our property safe via well-connected approaches across political and organizational boundaries. Readiness on the health side to ensure we capture our takeaways, the things we learned from this experience, as another pandemic event will certainly occur. History has already taught us this several times. And then change integration. And we're going to talk about strategies for multidisciplinary public safety response. And those come across organizational, cultural, and tactical boundaries. But the key point is that we can't fear change as we go forward. So as we now, I'm going to go ahead. I want to hand it to the panel. Colonel Patrick Callahan is going to get us started. So Colonel, if you're ready, I would like to hand over to you.
Thanks, Steve and Maria, and to my fellow panelists as well. Good morning, everybody. I really appreciate the opportunity and certainly appreciate the invite. A little bit about myself. I've been a trooper for more than 25 years. My dad was a Jersey trooper for 29 years and retired as a major. And my grandfather was a Linden police officer for 32 years. I grew up always wanting to be a Jersey trooper. And for the last 3 years, I've served as the superintendent and colonel of the state police. Consists of about 3,000 enlisted and about 1,200 civilians. Also, as part of that role of colonel and superintendent, New Jersey is one of 2 states where the state police is where the Office of Emergency Management is embedded. So it's New Jersey and Michigan. It's really the reason why I'm a member of the cabinet, not because I'm the colonel, but because I'm the state director of emergency management. I was the recovery bureau chief in the wake of Superstorm Sandy. Valuable insight, certainly from that, and lessons learned. A lot of exercising and training. The fact that OEM is in the state police means that we have troopers embedded in all 21 counties. And that's from a leadership and relationship standpoint, I think is what really guides us through these disasters and these times of crisis, because those relationships are made on, as we call them, the blue sky days. We're not getting to know emergency managers or our county OEM coordinators when a storm is coming, including yesterday. Yesterday was the tropical storm / hurricane Isaias came up, and we had 1.4 million people without power yesterday. So to Steve's point, the fact that there's a pandemic doesn't mean that we have the luxury of not going to 911 calls or not responding to fatal accidents or not responding to domestics or homicides. So we pride ourselves here in New Jersey really on those blue sky days when my phone rings and it's the Salem County OEM coordinator. I know who that is. They know who I am. And I think that constant communication, exercise, and training is critical. I don't remember the pandemic block in the State Police Academy, but in New Jersey, we do take an all hazards approach. I think when we started out, my first call about this was on January 22nd. And I think back to that almost 8 months ago, where we've come from as a state, as ground zero between us and New York City. The most densely populated state in the United States is New Jersey, 9 million people. And we're looking at all those things that were laid at our feet. Stop the spread of the virus, increase hospital bed capacity by 2,000 beds, secure as much PPE and ventilators as possible. And then the last objective that fell on our plate that we weren't really prepared for was certainly mortuary affairs, where we had the capacity, build capacity, with not only tractor trailers, but with a nursery warehouse in central Jersey that was originally used to store flower bulbs from Holland to simulate. We contracted with that individual for 10,000 plus square feet where we could keep thousands of decedents. It was nothing that we had really ever planned for, but we took charge of that. Certainly, one, to treat these decedents with respect, but also to track them too. We had some that had been admitted to hospitals under false names, and we needed our missing persons unit to fingerprint people. So Maria spoke about that playbook to go to after the Spanish flu in 1918. I don't know, state police formed in 1921, so we missed that by 3 years. Super Bowls or large scale events, presidential visits, all very easy to go to a playbook for. This one, because of the transmissibility of it and the challenges that we were faced. Never before had 50 states been under a state of emergency. So the EMACS, the Emergency Management Assistant Compact, where you can usually send people and resources back and forth, that wasn't happening. Nobody from Florida was sending nurses and doctors up here. Nobody from California was sending people here. We had to really buckle down and kind of do it as a state, but keeping in mind that if we had the opportunity to come out of it, and if Massachusetts needed ventilators, we'd send them ventilators, and you started to see those things evolve. In the midst of the pandemic, and Steve alluded to it, we had the George Floyd murder in Minnesota. And again, the most densely populated state in the country, we had more than 500 protests, and just about all of them peaceful. We prided ourselves again on relationship again. I'm on a morning prayer call 7 days a week, 8 o'clock, with clergy from around the state, and where those relationship and those seeds are sowed, they pay off in dividends when you can stand on the city hall steps of a Newark or a Trenton or a Camden, New Jersey, and you have police chiefs walking side by side with clergy and protesters. 58 arrests and thousands and thousands and thousands of protests, and we only had 58 people to date arrested, and our protests are still going on. And those arrests really came across 3 specific events, one in Trenton, Asbury Park, and Atlantic City. But beyond that, more than 500 protests, 58 arrests, and again, another source of pride for us because we took the time and invested with relationships in our communities. And our communities didn't want to see their cities burn or have riots. There was an incident recently where a subject not from Newark showed up with the intention to cause harm. We believed him to be from Antifa, and it wasn't the police that escorted him out. It was the community that saw somebody coming in to do harm and gently took him by the arm and escorted him back to his car. And that protest ended peacefully without any outsiders. So to watch those things unfold over the last 6 or 7 months was not without its challenges. I think our communication with federal, state, county levels was phenomenal. We still have a weekly video teleconference with the White House, led by Vice President Pence, who's the coronavirus task force head. The president would get on every now and again, but weekly phone calls when we said we need X, and not once did this administration not come through for the state of New Jersey, regardless of what we asked, whether it was remdesivir, whether it was ventilators, whether it was PPE, whatever they were able to send us, whether it was Department of Defense medical staff. They helped us build 3 field medical stations with the Army Corps of Engineers. Again, all back on relationships that were forged when things were going well. Army Corps of Engineers as a coastal state, from beach replenishment projects to environmental preservation, the relationship we've had. When I saw that engineer show up from the Army Corps of Engineers to help us with the field medical stations, the first time he was here was when Route 35 was wiped out after Sandy hit us. And he was the one, the engineer designed, and he said, I want a plan by 2 p.m. And the Army Corps had a plan to him by 2 p.m. and so be it. And that was, that was 8+ years ago. So to see those folks come back into your life, certainly, again, a tremendous source of pride for me. So from pandemic, civil unrest, yesterday, tropical storm / hurricane, and it comes down again, relationship, exercise, training, and to prepare for the worst. And I think in New Jersey, on all those fronts, again, the time that we've invested in relationships above all else, I think from my perspective, from a leadership perspective, it's invaluable. It's invaluable when you take the time, because if we're getting to know each other around yellow crime scene tape, or if we're getting to know each other when bridges are wiped out and trees are down and 1 million people are without power, it's hard to build trust in moments of crisis. And if you do it on a day like today where it's 82 and sunny, that's probably my greatest recommendation and takeaway from everything. That's all I got, Steve. That's how many questions for me.
Yeah, Colonel, I have one question because what you just now finished with, is I think it's a real definition of leadership. But there was one dimension of this that I think was extremely impressive, and that's you have more than 560 local law enforcement agencies around the state, and the state police, unlike some other states, I'll say California because I grew up there, I know that one. They don't provide local policing services to communities or any form of patrol at the state level. How did you keep them, tuned in to everything that was coming down from the governor, from the president? How did you do that?
Great question, Steve. Thank you. We have our Fusion Center. We call it our ROC. It's our Regional Operations Intelligence Center. I think the other key part of that is our State Emergency Operations Center is co-located with our Fusion Center. So if you can envision the bottom floor was all about pandemic and, preparedness, response, mitigation efforts, while the upper floor was contact with, as you said, more than 560 or 500 police departments on a daily call. We had a daily call at 9:15. One, we wanted to give them information about executive orders that were coming out almost every day between the governor and myself, whether that was closing churches, closing barbershops, wearing masks, capacity limitations on indoor and outdoor activities. And these police chiefs were, we all were kind of drinking out of a fire hose. But that daily call at 9:15 allowed them to ask questions on how are we enforcing this? How do we interpret this executive order? But it also allowed us to collect information from them. How many officers did they have tested positive with COVID? How many officers were self-quarantined? We wanted that statewide perspective because as the state police, if we needed to go in and assist or backfill Newark Police Department, we could. If we needed to go anywhere without the state. So that collection of data, analyzing that data, and I think that daily phone call was phenomenal through this, allowing them so many opportunities because I wasn't in a local town where you knew all the restaurant owners and you knew all the pastors. Those police chiefs were being asked to go out and shut places down as well as their officers and or cite people for a violation of executive orders. That was not easy for them. And I think that call gave them the opportunity to clarify things and also to ask for the interpretations of what those executive orders. So our Fusion Center played such a critical role day in and day out and still do. That call is now Tuesday and Thursday. It's not every day. But as things start to reopen and we peel this back and start to reopen, the connectivity with our local police departments is phenomenal here in New Jersey. Thanks, Steve.
Thank you, Colonel. Dr. Hazel, you might be muted.
Thank you, Steve. I'm Bill Hazel. I am an orthopedic surgeon by training. I became Secretary of Health and Human Resources in Virginia in 2010, and I served under two governors, Governor McDonald and Governor McAuliffe, two different parties. It's an interesting experience. And I can tell you that during my time there, we had everything from A to Z, anthrax and avian flu all the way to Zika, with a little bit of Ebola, MERS, and SARS thrown in, along with our regular natural disasters. At one point, we had an earthquake, a Dismal Swamp was on fire, we had tornadoes in the Southwest, and a hurricane was coming up the coast, all within a 2-week period. So you begin to get a little bit of a flavor of disaster preparedness and response from that. And I think the thing I'm most grateful for this year is that I'm probably not the Secretary of Health and Human Resources in Virginia at this point, because it's a tough job. But I would say there are some lessons learned, and I was preparing for a different meeting yesterday, and I came across an article that quoted a German field marshal from the 1800s, Field Marshal Moltke, who said that no plan of operations extends with certainty beyond the first encounter with the enemy's main strength. And Churchill rephrased that during World War II to say that plans are of little importance, but planning is essential. And how many of us have the plan on the shelf that someone put together after the last war, the last disaster, and it was put together with an eye on that last war and last disaster, and it sits on the shelf. And the people that did the exercise, that did the work, the ones who are there, their memories have faded. Some are gone on to others. The relationships that Colonel Callahan mentioned aren't in the room anymore because they've gone. And the plan sits on the shelf, and you can't just pull it off the shelf and dust it off. I learned that coming in, and I learned that going out. One of the seminal messages for me between my first and second term is one of my fellow secretaries came in and he was shaking his head and he was sitting down, he said, and he was rocking, and he says, I can't believe what they did. You know, I thought I knew what was going on and I didn't. And I sat there looking at my computer screen and I said, I can't believe the mess the guy before me left me this time. And it was me. So, you know, we have to remember that these things are there. But some of the particular challenges, I think, that we have in this situation really refers, and I think Dave's going to talk a little bit about a lack of imagination. But the events change, and you have to constantly do the exercise. Coach Gibbs used to say with the Redskins, you practice like you play, or you play like you practice. And I think one of the things that happens is we get into our day-to-day work and we get overtaken by events and we don't practice and we don't create the relationships that the Colonel is talking about. Sometimes you need to call an audible. That plan is not going to survive first contact, Colonel, with Sandy or with the George Floyd murders. And we have this situation now, which is really, I'm not sure it's unique, but you have a pandemic. You have a pandemic that we don't completely understand because this is a new organism. Pandemics have been with us forever. Most of us heard about anthrax in the Middle Ages, or most of us, or the Black Plague, I should say. We know that as civilization spread throughout the world, the European civilization, there were measles outbreaks and other diseases that wiped out populations. This is not new at all. And as mentioned in our time, we have seen things like SARS and MERS and tuberculosis is still there. So these still exist and are very real problems. But you put that in the context of disparities, population vulnerabilities, which have been exacerbated by this. You've heard, and then you get a George Floyd situation where suddenly you're igniting the fuel. And then we have a hot summer. We've seen hot summers in the past. Colonel, you may not have been there in 1918 for the flu, but you were there in 1968 for the hot summer after the assassinations. We have international tensions at an unprecedented level. I think a very, very warm war, if not a hot war, going on in several areas. Elections this year, which create social division. And quite honestly, we have mixed signals from the top. And I think one of the things we have to do as we plan is to acknowledge the challenges. You have to be able to say them. We may not like to say them. We may be reluctant to say them, but you got to say them, that there are challenges there that that come in our leadership. So what can we do? I mean, we can talk about the problems, we can applaud the problems, but what can that we have to keep the practice. We have to, again, practice so that we can play. We have to maintain those relationships. That means someone in leadership has to prioritize this. And I think what has happened and what I've seen is that leadership in state government tends to be a little more knowledgeable and familiar with the day-to-day events, the hurricanes that come every year, the things that repeat. That Colonel mentioned, you have a local, maybe widespread, but fairly localized situation, not worldwide. You have a time-limited situation. We aren't good at chronic conditions. We like things to get done and get things out. So you need the leadership to help set the stage and the communications. And you have to have someone like the Colonel or David who's there every day who says, my job is to keep us ready and to maintain these. I don't think it happens without. The community piece is important in this because the priorities in the communities are different. You can see our big divide is between the health, safety, and so forth versus the economic sequelae of this. And the truth is, it's a false choice. You got to deal with both. And we have to recognize that in the leadership. And to do that, you have to understand the communities. There's this need for information. One of the things that happens when you have a new problem that you've not seen before, like COVID or coronavirus, is that we probably didn't recognize it when it came to the United States. But had we been paying attention, we all were aware of Wuhan. We just didn't put it together, I think, in a way that was useful. There were some places that did, and other places that did not. We were thinking West Coast, and what happened, it got to New York through Europe. So the ability to recognize, to collect the data, analyze it, create useful information, separate the signal from the noise, it's all really important. Another piece where I don't think we were quite on target is our ability to deal with government processes around procurement and workforce. Had any of you heard of a contact tracer before a month ago? Some of us did, but government is not good at surge capacity, as we know. And so we need to be creative as we're thinking about the relationships. Sometimes when we're doing these planning, we got to allow the things that we say, well, that will never happen. Well, it just happened. So we need to be able to think creatively and be sure we have those pieces in place. We also need to update what we already know in terms of dealing with the last things. We have the stockpiles, but we know that some of that's outdated. We haven't kept it up. Had we had something we already knew about, we might still have trouble. So we need to deal with that. Colonel has also highlighted another thing that's unique to the medical and pandemic world is dealing with the casualties. He mentioned mortuary services. It gets to be, but what about the hospitals? When we were dealing with Ebola, we didn't know when it came to the United States some of the things we thought. We thought that it was going to be much more contagious than it was. We thought that it couldn't be treated. It turns out, fortunately, that it was less contagious and more treatable. But as we looked at building the capacity in the hospitals, where do you put people who are sick? How do you do the issues of isolation and even go to quarantine? These are things you have to constantly have community discussions about and understand to make it work. Then I think the final thing is the communication, because the problem, at least with Ebola, was not just the disease, but was the panic. And being able to manage the panic with a consistent message. And we have to be careful that it is not overconfident. If someone stands up and said, we've got this, and then somebody dies of it, your plausibility is gone, your confidence is gone. So we need to be modest but firm in our confidence. So I think there are things that we can do, but the big thing is to continue to have someone in charge, continue the planning, and keep the ball moving. Be creative as we explore the next wave of problems. I think you're muted, Steve.
I was, thanks. So I do have a question for you. In this, I'll just say this, broad concept of readiness. And I really like the, Churchill statement about plan versus planning, as planning is invaluable. And when you talk about a subject, just pick one that you talked about, surge capacity. One of the things that we did in the counterterrorism sector was a lot of exercises. And they were done regularly, and they were done to practice hypotheticals, whatever it might be. In this area, from a public health standpoint, what do you think about doing something like that? Because I think there is a danger still of the plan going on the shelf, because these things happen sometimes in 15-year cycles. What's your thought about having a practice of doing exercises?
I think you have to. A good friend of mine called me last summer, and he was just appointed commissioner of health in his state. And he said, what would you do? And I didn't think about this initially, but before the conversation was over, I said, the first thing you need to do is go meet your emergency management folks and understand what tools you have and how that works. And at that point, I had never heard of coronavirus. And I think I sent him an email or text last week, and they're doing okay. But those are things that I think the health world has done. CDC does, the health commissioners do. I'm not sure that we are always communicating and doing it in tandem with our colleagues in other fields, be they Homeland Security, law enforcement, wherever. It happens, perhaps it's not as formal enough. And I think part of that, Steve, goes to the fact that very few governors come from the health world. They are lawyers, prosecutors, law enforcement, business people. They understand one piece of the world, but our whole health literacy, public health literacy is lacking. So these are things that we have to practice with the public too.
Well, lucky for us in Virginia, we do have a person from the health world. Just a piece of information. Director Mulholland, let's talk about the challenges of emergency services.
Yeah, absolutely. Good morning, everyone. I am Dave Mulholland. I am the director of the Emergency Communications Center here in Arlington County. I have 32 plus years in public safety, 27 in federal law enforcement. Retirement didn't agree with me. I realized I was a government lifer. Went back to work for the government as the statewide interoperability coordinator for the District of Columbia before coming here to Arlington. So I'm going to pack a lot into the next few minutes, but I'll start by stealing a song title from REM. It's The End of the World as We Know It. Very applicable for what, especially in emergency communications, we've gone through over just the last 4 or 5 months. The good news is it's not the end of the world. It's the beginning of a new one. So who would have ever thought a pandemic, major civil unrest, significant weather event all at the same time? This has not how our tabletop exercises ever worked. Could you imagine going to a tabletop exercise and they're saying, okay, you got this pandemic and this is how it affects you, and people can't be within distance of each other, and you've got to do all these things, and you're working through how you do that, and then comes the next inject. Wait a minute, you got some fires being started, you have peaceful protesters that are shutting down traffic, you have this major civil unrest, and you're like, okay, all right, we'll work through this. And then the next inject comes and goes, oh, by the way, you got a hurricane. You just throw your hands up. You go like, I quit. This is not realistic. This is stupid. This would never happen. Who thought? So what we're going to do in the next few minutes is discuss 3 things in the emergency communications world whose time has come to an end, 3 implications of it, and then 2 strategic considerations. So the silver lining of COVID is that it is the end of things that need to go. The first is it's the end of business as usual. So what we hear people say is you can learn from the past, and that's true. You can learn from the past when it comes to challenges, but we have relied way too much on the past from our successes. There's a great book written by a good friend of mine, Bob DeSortis, about public safety interoperability, and in that book, he talks about the commission that Congress had after Pearl Harbor to examine what happened, what went wrong, and he identified 25 failures that occurred, most of them human failures that occurred that led to Pearl Harbor. He then examined 9/11, Hurricane Katrina, and one other, I don't remember what it was, incident. And what he found is those 25 failures continue to manifest themselves. And I think if we went back and looked at what we're going through right now, we would see the same thing. And one of those is the failure of complacency. We're just too used to doing things the way that we do them. Again, how many people have ever heard this phrase? If it's not broke, don't fix it, right? And so we rest on that. Well, here's the news. It's going to break someday. And when it did a few months ago, it broke big. What do we find in emergency communication? Traditional brick and mortar approaches, this is the way we've always done it. It works. Why would we ever think about doing something different? It severely limited our flexibility. We got cutting edge technology. 5 years we invested in this system. 3 years ago, we invested in this system. This cutting edge technology. It's all we need. Reminder, cutting edge technology of yesterday is obsolete tomorrow. Sometimes it's obsolete today, right? So complacency has to be quickly replaced with visionary adaptability. Early in the stages of this, not everybody saw a need to change. When we built our center several years ago, we stole a book out of the fire department and we built a really nice kitchen. We share a building with the police department, the court system. They love to come use our kitchen. As soon as COVID first broke, in order to safeguard my employees, we banned access to the center, which meant no access to the kitchen. Man, you would have thought that I was taking people's homes and children from them. I got hate mail, literally hate mail, because we weren't letting people into our center so that they could get their cup of ice water or cook a really nice meal on our Viking stove or whatever it was, right? Because we didn't see that there was any need to respond to this thing out there. There was no need to change. Business as usual. Death of business as usual. Second, it's the end of proprietary, territorial, parochial, and non-standard systems and processes. What do you do when you run a medium-sized 911 center where you have to be here to answer calls, and one of your employees potentially may have COVID, and on the day before going potentially symptomatic, interface with 75% of your staff? How do you quarantine 75% of your staff and still conduct business? You can't do it if you're not ready to do it, right? So we weren't ready. When we had to adapt and change real quick, we faced challenges. Our procurement pipelines quickly became clogged. Everybody's now trying to buy stuff that they should have been buying. It's what the bill just said about the stockpiles, right? Now everybody's all trying to buy it at the same time. So your struggle at a personal level to find Clorox wipes or hand sanitizer was our struggle at a professional level, right? Or to buy an electrostatic sprayer, which 6 months later, I'm still waiting for it to show up. my UV lighting system for my HVAC. 5 months later, the parts just came in, right? We weren't ready. Our method of access to get in, if we want to work remotely, because that was a big solution for us, go to remote. So we are using outstanding technology to get into our systems. If this was 10, 15, or 20 years ago, we're using remote desktop, completely dependent on systems that exist, that have to be up and running. But what happens when other people that are affected by your pandemic aren't there to run those systems, right? VPN. Okay, yeah, VPN's a great technology, except my folks require access to 5 different systems. 4 of those require 4 different VPN connections. How does that work? So now what I have is a person sitting at home with literally 5 different computers sitting in front of them because each one requires. We weren't ready. We didn't think this through. Legal restrictions presented challenges to us, right? Accessing the criminal information network from someone's house. Good luck with that. We got a little bit of a workaround where we have a little bit of access, but fully doing what we're able to do, we can't do. Hiring processes, challenges to that because we didn't think ahead. So we want to change our hiring processes, virtualize them. That's great. What about things where they have to submit something to us that's been notarized? How do you submit a notarized document that shows a seal virtually and acceptable to the county attorney's folks? Tough to do, right? So communications technologies, yeah, we can share resources, we can load balance, we can do all these things. It only works if you have standardized processes and protocols, if you have governance and agreements that are already in place, if you have unified technical solutions, but all that has to be thought of on the front end, not the back end. And then on top of all that, you have cybersecurity concerns. So you have to take cybersecurity into consideration, but you have to balance that with the need to access anytime from anywhere by any authorized person. Okay, so third, it is the end of us living in a comfort zone. There's value in a remote workforce. There's better response to emergencies. I can do a pop-up backup center. So now I can go to the county manager and say, hey, that $35 million CIP that we would ask for to replace the backup center a few years down the road, we don't need that anymore. We can do this with pop-up centers. Talked about the hiring advantages of doing remote hiring processes and also people being able to work remotely. They don't have to live in the county where I am. I could have a person who could be a call taker for me who now lives 2 or 3 or 4 states away, right? But we were comfortable in the way that we did it. Moving into this remote workforce takes us into a whole different level. Our budgets, we were very comfortable with our budgets. We know how they work. We know there's a process. What we didn't account for was a massive impact. So for me to have a remote workforce costs about $80,000 to $90,000 per person. We never budgeted for that money. I got to do it, which means somewhere I've got to come up with, for each person I move into a remote capability, I've got to take $80,000 to $90,000 out of something else in the budget, right? Because we never planned for it. We lived in that comfort zone. Supervision, we're very comfortable with how we supervise. Now I'm going to push you into a level of discomfort because you're going to supervise people that aren't physically sitting in the same room with you anymore. Not easy to do. Mental well-being. I'm not going to say we were ever necessarily comfortable with how we handle mental well-being, but we're really pushing into an uncomfortable level in dealing with mental well-being, right? Because how do you deal when you're at work with the fact that your children are supposed to be home virtually learning now and you've got to be at work, right? That's a mental stressor on you on top of a job that already is significantly providing mental stress. Okay, maybe one of the options is I let you work from home. How do you deal with that? How do I monitor stress now? One of my advantages is a supervisor during a high stress incident can sit there and watch the employees, and they know that employee is reaching a breaking point. Maybe we need to have somebody else step in and handle that or do a debrief immediately after that. There's not that physical interaction to do that. Working from home. One of the things we stress in 911 is maintain a good, healthy work-home life balance. What happens when work becomes home life or home becomes work life? How do you maintain that balance? So it's moving into this new world where you're no longer in a comfort zone. It is the end of living in the comfort center. All right, so quickly, what are the implications of this? Number one, change must become part of our practice. Starts at the top. Folks know, especially folks that have worked in an executive level, there's different types, right? When you go to apply for a job, what kind of leader are you? I'm a maintainer. You give me the status quo, I can make it work, right? Or there's people who tout themselves as, I'm a change agent, right? And so sometimes when they were looking to fill positions, they would say, we are looking for a change agent. Every position, for every leadership position now, must say, we are looking for a change agent, because we have got to be constantly changing. Change has to be baked into our practice every day. It has to be reflected throughout the whole organization. Change has to be built into your policies, your practices, your strategies. Second implication is for hiring. It's a shift and focus on different skill sets. There are now technical skills that we're going to require of our workers. In a brick and mortar facility, something doesn't work, you shout down the hallway, and the systems manager comes running down, and they log in to your thing and they fix it. When you're working from home, you are the help desk, right? You are the first one. You're the one that's got to know, hey, let me do some quick things, because these are 911 calls. We don't have a lot of time to pick up the phone and call somebody and get tier 2, get tier 3. The first efforts need to be at your level. The second thing that we're really emphasizing now is critical thinking skills. I think for too long, we have spoon-fed 911 employees. We've made them too dependent on the folks that sit around them and supervisors. They're working independently. There's no one to lean over and go, hey, how would you handle this call? Hey, what do you think I should classify this in the CAD system? Hey, what unit do you think it's recommending this, but I really think I should add this person? They're not there anymore in a physical way. So we really need to target problem solving. We need to target people that can work without direct supervision, people that are comfortable with being empowered to make a decision, and comfortable that the organization says, not everybody's going to always make optimal decisions. It's okay, but we're going to empower you to make those decisions as long as you can articulate. The third implication of this is for systems. If you are a solution provider that's participating in this webinar today, listen to me closely. The age of the client server is dead. I need access anywhere, anytime for any authorized persons. Whether that's a person sitting in their home working, or whether it's a pop-up center that I put somewhere, they have to have access to that. I cannot be dependent on any single points of failure. Client server is going away. My remote workforce needs access, ease of access, that is in the cloud access. Huge implication. All right, 2 quick strategic considerations. First, think outside the box. All right, that's our nice little cliche. We always say that. But I mean, really do it. Do it every day. Bake it as part of your practice, but also do it very strategically and deliberatively. Hold visioning exercises and think crazy. Nothing is off the table, right? Whoever thought that we would have all these 3 things happen at one time? None of us. What we're not thinking about, what we should be doing is saying, okay, so what's next? What other weird, wacky thing can we add on top of this, right? That's what we need to be thinking through. And then how do you reinvent yourself because of that? And start that reinvention process now. And then finally, strategic consideration. You really, when you get into something like this, you need to identify and prioritize your core responsibilities and capabilities, because you got to be able to do 3 things to be responsive. First, know what you can shed. What is it that you do that if you didn't do 5 minutes from now, it's okay, life still goes on? It was a nice thing to do and it had some value, but the world doesn't stop spinning if you stop doing that. Second, know what you can share. Is there somebody else that another center, another capability in the county government? Is there somebody else that can share these responsibilities? You're still going to keep a piece of it, but they're going to get a piece of it as well. And then finally, know what you can shift. What is it that you do that you can then send to somebody else to do? And that stuff still gets done because it's important, but it's being done outside your center. If you can identify those 3 things, what can you shed? What can you share? What can you shift? It's going to make your life so much easier, because it doesn't depend on what the next incident is. You already have that plan in place.
Thanks, Dave. I have a quick question for you. I think you know, there's something that adds up in all the discussion you're going through now. And I want to ask you about, you know, in your experience at this point, and in your effort to try and make some change, you know, is there a cultural resistance, and is it coming from a specific area of the, you know, the organization?
There is, yes. There will also, change always brings resistance at some level, right? So it's happening in two ways. One is it's again taking people out of their comfort zone. This is the way we've always done it, and we don't want to do a different way. So you're going to get some pushback from that. But two is these things that I just talked about, they're taking away some significant power bases, right? And a lot of that is, you know, I used to love the phrase, we are replacing the, you know, the concept of knowledge is power with the concept of knowledge is empowering, right? But so, well, when I say people need to be able to do some certain level of troubleshooting, let's say with a CAD system, and in an organization, you may have a person who was a CAD manager who did not want to let people know for whatever reason. One, because it was my power base. This is my system. Nobody's going to touch my system except for me. I don't want anybody going in and changing anything. So, you know, there's a loss of a power base. I think that creates some pushback and creates some resistance to how you change. And then I think overall, all this kind of forces you to do some organizational change. Some positions are no longer necessary. The reason I was late to the check-in meeting right before this webinar is because we were holding a meeting with about 15 folks from our department, because we are completely reorganizing our department in this new environment, right? So a lot of questions to come back. I think the key, Steve, is to figure out when you say, is there organizational resistance, is to cut through and determine, is it just fear and need for clarification, or is it actual resistance because I get it and I don't like it?
Steve, if I could jump in, what I would see at the state level is that the structures of state budgeting, county budgeting, can be really a problem. I can give one example of where we were looking at a jail diversion health system for mental health. The whole idea we've accepted these days, sending people with mental health issues to jail is not a good thing. The right thing to do is to move them to intervene early and get to treatment. Well, in one community, everybody had agreed except one person, one critical person, a constitutional officer, the sheriff. Now, why would the sheriff object to that? Well, the reason you would is the state budget supports jails based on the number of prisoners, right? So it's legitimate. If he doesn't get state funding, he has no deputies and there's no law enforcement in that county. He's got a real problem. And so we need to be able to look beyond our traditional, what we used to call in Virginia, our cylinders of excellence, our silos, and say, all right, it's the money flow, I think, that becomes a problem. And government at all levels looks at pieces and programs. We look at behavioral health, and we look at healthcare, and we look at juvenile justice, and we look at law or jails and prisons, right? All separately, and they all get their piece. But the truth is, they all have to interact, and we haven't figured a way to do that in the budgeting.
Well, Bill, that's a great point. I'm going to I want to take a second here, because as you guys have noticed, the colonel has left the call. He was called into a situation, so this is a perfect example of the way life is today. So he apologizes, but he had to leave us. And at this point, what I'm going to do is I'm going to ask Alex McAdoo, who's one of my colleagues here at IJIS, to come in, because there are questions that have been popping up while we're talking. And I'll ask Alex to jump in here. I mean, we only have 5 minutes left, so I think, Alex is just going to explain how we're going to deal with these questions, because we're probably not going to be able to answer them right now, but we will answer them.
Thanks, Steve. We have a couple of quick questions that I think if we can shoot between Bill and Dave that in about 2 minutes, I think that'd be great. We have 3 questions. I'll start with Gina's question. She's asking, how has COVID-19 impacted your ability to communicate with other agencies/organizations in the field? What are the most pressing needs for communications and situational awareness? Dave, do you want to start?
Yeah, so it really upped. The beauty is in the National Capital Region here in DC, we have 2 different collective groups, actually 3 collective groups that meet regularly, that are very formalized, that ensure that we are all talking with each other to begin with. It upped the ante is what it did. It took meetings that were quarterly or monthly and turned them into weekly meetings. I think the problem that we ran into, Gina, was we actually started having very redundant meetings because each person wanted to have a COVID update meeting. And so, you can only say what you did so many times. And after you hear it the 4th time in a week, then it starts to lose it. But the most pressing needs for the communications and situational awareness, it really was, I would say the most pressing need was get rid of your structure when you have these communications. The better meetings were more free-flowing, conversational. Hey, what are you guys doing about this? We just ran into this. How are you addressing it? Is anybody else seeing it? But I think it's all predicated on having existing structures in place where people are already talking to each other.
Alex, I would just add one thing. It's not just to have the structures, but to have the relationships in place so you don't spend your whole hour trying to figure out who's doing what and why they're doing it.
Can I throw one thing on there? One downside. So we've seen a tremendous upside in the ability to meet virtually, Microsoft Teams or WebEx or Zoom or whatever. These are great tools, but on that building relationship side, those meetings we used to have that included a time for lunch and being able to talk to each other, we've lost that. So while technology has given us the ability to communicate with each other, we are starting to lose the ability to develop those relationships at a personal, in-person level.
Great, thank you both. Moving on to Kevin's question. Would you discuss the need for and processes used to ensure critical information sharing among agencies? Dr. Hazel?
Yeah, this one's, since I'm not in the state government now, I'm going to go back to the work we did around opioids. It was a much slower moving crisis. We're losing a lot of people too, and I don't know that we recognize it in the same way that we do COVID, but it is a health issue. It is epidemic, if not pandemic. And I think that we have to look at sort of principles of what I would call collective impact, where you are identifying a problem that all of us are agreeing what a problem is, figuring out what success looks like, trying to set some common goals, some common metrics for success, because you can't rewire easily all of the organizations at all the same time. And then once you do, it'll be outdated in a day or two. So the idea is to find ways to have a backbone structure that manages communications and messaging so you can know what each other's doing and you can all accrue to the same endpoint. There's a great article from the Stanford Social Review from 2010. Anybody wants to read it, on collective impact, but I would use that as a model.
I would add in there that I think one of the really key pieces is having governance in place. Again, in the National Capital Region through the Council of Governments, we have an MOA that has been signed by several dozens of agencies in the area on information sharing, because you don't want to have to start to work through some of the how do we do this when it's time to do it. So having that on the front end, listen, the technical piece of it, the getting everybody together, knowing what you need to share, that's the easy piece. Working through the attorneys on who can share what, that's a tough piece. And one nice little nugget we found, when we go to write such policies in this area, what we've learned is we develop talking points and we give it to the attorneys and we let the attorneys write the policies. Because traditionally what we did was we wrote a policy, gave it to an attorney, they ripped it up, gave it back to us. We're like, no, this is nothing we wanted. So we work in partnership with the attorneys on the very front end of writing policy. But if you got to have that governance in place.
We're involved in a project now in Fairfax where we're looking at communication of really sensitive personal information between law enforcement, jails, health, and human services. It happens to be around the opioid problem. But having the agreements, David is absolutely right. Figuring out how to have the agreements in place about what can be shared and how is essential, particularly for trying to get down to individual interventions.
All right, I know we're getting short on time here, but I don't want to miss Anil's question, who's asking, as you address COVID-19 challenges, do you have any I wish moments, in the sense that I wish I had a tool, capability, guidance, or mechanism that did X? My job would be so much easier if we had this. Can you guys give us some insight into any of these?
I wish I had a tool that could take a nap for me every Wednesday afternoon so that I'd be up to the challenges, but that's a different problem. I would say, Alex, that the tool that I feel like I needed at different times was, well, actually a couple things. One is the ability to get information. When you're dealing with health things, health system is really institutionally based, and after a while and with some tugging and pulling, birthing of elephants, you can get information out of that to inform what you're doing. But most of health is in the community. And the community includes what's happening in homes and doctors' offices and clinics and prisons and jails, and it doesn't all mesh together. And I think that from a standpoint of trying to get a big picture, had we been a little more alert, we might have understood that COVID hit us earlier. And that alertness would have come from a better ability to call through the information.
Yeah, the one thing that I think I would say, the one big wish I wish I had was something that could really idealistically, automatically, I don't know how that would ever work, but facilitate capturing information as we go through this, because I think most governmental organizations are designed to work in the day-to-day environment, and then you add major things like this going on, and we're literally surviving from the emergency of the minute, day, month, year, and we're not capturing. There's so many great successes and so many challenges and lessons learned, and we're doing our best to maybe once every few weeks sit down and say, what do we have out of this? Or kind of get together all those little sticky notes and scraps of paper where we write something down. If there was a tool that really made capturing all this in one place in a logical way, so that when it was done, there's a playbook that we can use to apply to other things, that would be ideal for me.
Great. Thank you both very much. And Steve, that's all it for the questions. So I'll kick it back over to you for any final comments.
Okay, we're a little bit over time, but I as we talk planning for this, I'd like to ask each of you to make a final comment, 90 seconds, to just anything that we missed or that you didn't, the questions didn't get you to be able to express. So, Dave, we'll start with you. If you could do it about 90 seconds.
Yeah, I think the one thing that I'll stress is this is a team effort. We advance so many new capabilities by learning from others. So that constant communications with everybody else across disciplines, across jurisdictional boundaries, across level of governments, we all learn. The old phrase, all ships rise together, is very true. So rely on those resources. And number two, the old Apollo 13 failure is not an option. It is absolutely an option. It is. You're not going to do everything right. It's okay to try something and it doesn't work. These are iterative processes. Learn from others, try, do what you think will work. If it doesn't work, it's okay. Move on to the next thing.
Bill?
I think that I would ask that we look for consistency and continuity of efforts. What I found, I mentioned between first term and second term and now out, I watch a new group come in and I say, oh, I've made that mistake. Yep, I've made that mistake. And there's, I think, in our effort in the political world and government world to be new and different and refresh, that sometimes we throw out some of the institutional knowledge that actually is useful. And I applaud you for having this conversation. I hope everyone is able to learn from it and to actually act on it.
Well, thanks to both of you. Thanks to Colonel Callahan. This was an excellent discussion. And I want to remind everybody, our panelists as well as our audience, that this is there will be more coming. We touched on a lot of subjects where we expect to have a lot more discussion, and so just be ready for what we're going to do as the next steps in this area. Again, thank you, thank all of you who listened in today, and have a great day and stay healthy.